Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to the WISPIC informational webinar for NAS, NOWS Initiative Pilot Sites. Everything you need to know to decide if you should apply. And I am Eva Fassbinder-Brummel, and I will be helping to moderate today's session. We also are honored to welcome other speakers that will help to flesh out all of the issues that we want to discuss today about the application process. And those folks are Lisa Locken, Paul Neary, and Eileen Zeiger. So the purpose of today's webinar presentation is to provide basic information about the pilot for WISPIC's neonatal abstinence syndrome, neonatal opioid withdrawal syndrome initiative. Participants will also be able to use this information from the webinar to decide if you should apply for consideration for one of these 6 pilot sites. And to give an overview of what we're going to do today, we're just going to go over the background of the initiative generally, and then get into some specifics of the NAS NOWS initiative and next steps, and then of course questions about the application process or about the initiative at the end. And I want to let you know that if at any time you have a question, if you have a question before the end of the presentation, before the set aside question time, that's perfectly fine. Make sure to just raise your hand. Just use the hand icon in your GoToWebinar control panel, and I will see that and be able to take you off of mute. We'd prefer it if you just went ahead and asked your question that way, but if you're more comfortable, or for whatever reason, if you'd like to use the question pane, you can type your question in and I'll see that as well and make sure to relay that to our presenters. Okay, well, we're going to get started here by turning it over first to Lisa Locken. Lisa, go ahead.
Thanks, Eva. First, a little bit of background about the history of the grant and actually of WISPIC itself. So WISPIC is the Wisconsin Perinatal Quality Collaborative, and it was founded in 2014 by both WAPC and other partners committed to improving perinatal care and health using a strong evidence base and quality improvement science. WISPIC's early development was supported by a grant from Wisconsin's Department of Health Services. And then in 2017, so last year, the CDC released a notice of funding opportunity, which is an NOFO, for state-based perinatal quality collaboratives. And what they were mainly looking for was to fund states to support enhancement of their capacity for their own perinatal quality collaboratives who were in the early development stage. So that's those collaboratives that are 6 years old or less. And so that's right where WISPIC fits. And the idea is to improve perinatal care by actively conducting QI projects that improve maternal and infant health. And the grant was not small. The total project period is for 5 years, and funding was up to about $200,000 per year. So as you can see, we were able to get this at just under $1 million for the entire time. Working on this, WISPIC members considered a whole range of possible clinical initiatives, and we weighed strengths and weaknesses of each in the context of what are the current needs and resources that are available to us here in Wisconsin. And members finally decided to commit to the proposal on the topic of opioids in the perinatal period, and they identified the needs of both infants and women as the proposal's focus. So, with that in mind, WAPC did submit a proposal to the CDC back in April of last year and was notified of selection in August. So that started the kickoff time for this project. Next slide, please. Now, what are the goals of the grant? We had written in there 5 main goals, and I'll talk about them a little bit. One is to increase the capacity of WISPIC, and by that we mean how can we get more organizations, and again, WISPIC is an organization membership group, whereas WAPC is an individual membership group. So how can we get more organizations engaged in WISPIC? So as part of the grant, we're trying to get more hospitals, more organizations that deal with moms and babies, throughout the state of Wisconsin involved in the collaborative. So that's one thing, and by participating in the pilot, that does help with that. A second thing is to strengthen the data infrastructure. Actually, the CDC was really impressed with peridata.net as being a solid base, if you will, for data collection and aggregation throughout the state of Wisconsin. And we're going to be able to use some of the money then with the grant to enhance technology. We already have something that's fairly robust, but continue to make great strides in how data can be entered, manipulated, moved around, etc. And again, part of the pilot work will be helping to test some of that out. The last three goals are more directly related to outcomes for patients and families here in Wisconsin. The first of those is to improve identification of infants at risk for NAS and NOWS and to standardize treatment. The second is to improve identification of women with opioid use disorder. And the third is to improve care of women with opioid use disorder. And as you can imagine, that's a lot to tackle. And so what we're primarily going to be talking about, at least in the first part and with the first part of the pilot, is mostly what you see as the third bullet point, improving the identification of infants at risk for NAS and NOWS and standardizing treatment. So with that, I will let Paul continue on.
Good afternoon. We will now review the pilot program for the NAS NOWS initiative. And we will be addressing questions regarding what resources will be available and what are the responsibilities of participants in the pilot project. And we'll move to the next slide. So you saw the goal earlier, which was, as discussed by Lisa, to improve the identification of infants at risk for NAS, NOWS, and to standardize the treatment. And as a result of the work of this initiative, we expect to see two principal outcomes. One is improvement in the service delivery for identifying and managing infants with NAS and NOWS. And two is improvements in perinatal measures related to identification and management of infants with NAS and NOWS. And the next slide, please. This slide and the next two outline three objectives and some strategies to accomplish this goal. So the strategies will be largely in place by the start of the pilot program. Throughout the initiative, we will continue to evaluate the needs of the participants, and we may likely add components to the change package. We may explore different communication strategies, and we will certainly recruit sites for the launch of the full initiative. So our objectives and strategies for planning the initiative to improve identification and treatment of infants with NAS and NOWS and standardizing the treatments, we have identified and selected the data elements and data sources. We have identified educational objectives. The change package has been developed. We have identified strategies to improve communication between obstetric and neonatal providers, and we will subsequently recruit sites for participation in the pilot project and in the subsequent statewide project. Next slide, please. So another objective and strategy will be to implement the initiatives. We will begin the pilot initiative and subsequently we will launch the statewide initiative. Next slide, please. There will be ongoing evaluation of the initiative. This will commence with evaluation of the pilot project as the pilot project progresses. The plan will be revised as needed based upon the evaluations of the pilot. and the initiative will be evaluated as it is ongoing to assure that it is sustainable. Next slide, please. Our learning outcomes include obstetric and neonatal care providers developing a communication strategy for sharing information. We all realize that comprehensive communication is necessary for effective provision of care to mothers who suffer from opioid use disorder and from their babies and for their babies who are affected by this. Neonatal care providers will utilize an appropriate screening tool to evaluate infants at risk for NAS and NOWS, and will also use a standardized protocol for caring for infants at risk for NAS and NOWS. Neonatal care providers will increase the use of non-pharmacological strategies in their care of infants at risk for NAS and NOWS. Maternal and neonatal care providers will work collaboratively to engage families in the care of infants at risk for NAS and NOWS. Next slide, please. Communication strategies. Communication will be available through the WISPIC website. There is a password protected section, and this will be for entering the data. We have a change package which will help sites promote changes in practice within their birthing units. All the educational webinars and the learning collaborative sessions will be recorded and will be available for review by participants who are not able to watch the original live webinars. Other important information will also be available, as will the staff of WAPC. Next slide, please. The change package will provide tools for identifying infants at risk. It will provide some examples of a standardized protocol that will help with screening for symptoms, that will help with environmental and behavioral support, breastfeeding support, pharmacology support, and planning for discharge. Other resources will also be available. And at this point, I will turn this back over to Lisa, I think.
You are correct, Paul. Thank you. Outcome and balancing measures. Basically, when we're doing this, you know, one of my favorite questions is, so what? So how are we going to know if we're making progress and if things are improving? We've identified a handful of outcome and balancing measures that we think are important considerations. There's probably a lot of other process measures in between, but those are not shown here. And I'd recently heard something that it's good to have 3 to 5 things, and hey, there's already 6 here, so I think we've got plenty. So what are they? The first one there is the number and percent of infants at risk that are evaluated with a validated tool. So again, first we have to find out who's at risk, and then were we using a tool that has been validated. The next thing is the number and percent of infants treated using a standardized protocol. Again, the protocol is not necessarily going to be carved in stone that you have to use a certain thing, but the main idea is it standardized? It's not just somebody thinking, oh, let's try this today or that today. So we're wanting to know across our pilot group, for starters, how many times is that happening? We also want to know the number of infants with NAS and NOWS, because I don't think we have a really, really good handle on that, even right now across the state. Another important thing is the number of infants who are either transported or even transferred for a higher level of care. There will be a way to indicate whether that higher level of care even happened within your own organization or to somewhere else. One of the things we may be looking at is maybe, depending on if we're using a protocol that works well, maybe some of those kids don't even have to be transferred up to a different level of care. Another thing to look at will be the duration of treatment for NAS and NOWS. I mean, I think we'd probably like to see that over time, the length of treatment, because we're getting so good at it, would reduce. And corresponding to that then will be, what is the length of hospitalization for these babies, and are we able to move the dial on that even further? Next slide, please. And then my favorite, data collection and submission. The data elements selected for collection are directly related to the measures shown on that last slide. So a neonatal work group from WSPIC developed the types of information they felt would be important to collect on our patients in order to do this. Again, when you do see this stuff show up, it's going to feel kind of heavy on the baby side, because again, right now the first part of this pilot is focusing more on the baby aspect. There is a little bit of maternal information on there, but primarily it's the baby stuff. And we worked very hard to try to minimize the burden of data collection, so only going after the elements you really, really need. Not unlike taking a hike up in the Rocky Mountains, which is where I was the other week, not hiking though. You want to bring just enough water to get you through, but not so much that you're going to be weighted down and exhausted. And for this initiative, we can think about the data elements in a number of ways. We do need some maternal and infant identifiers so that we can do a matchup of who goes with whom. There'll be a little bit of maternal information about her pregnancy, county she's from, some stuff on substance use and so on, and then primarily infant information around the hospital course for NAS and NOWS. So identification, management, and treatment. There will also be a section in there on iatrogenic withdrawal, so that we're not messing up infants that had a withdrawal that was caused by in utero exposure versus something that was caused afterward. And then of course there will be some discharge information. The other thing I'm real excited for with this is we will be able to include outborn babies. For example, if you currently use the peridata.net system, its original intent was to be used as a capturing stuff around the birth event itself. So incoming babies that come into units from other places haven't had a place to put it. So we will have a sort of a portal type thing that you can enter outborn babies. Likewise, if your facility at present does not use peridata.net, you will be using essentially just this piece of peridata.net in order to put your information in for this. So again, we've tried to make it real easy. Anyone who might have participated in prior WSPIC projects, first of all, we started entering data using a SurveyMonkey, and then we went to the WSPIC site to enter it, and now we're kind of entering into a new phase of, again, leveraging the data capabilities in the peridata.net system. So this is a very brief overview. Again, for those of you who are selected for the pilot, we are going to be going into much more depth about what the fields are, how they're defined, and that type of a thing. So this is just an overview for today. So I think I go back to Paul.
Thank you, Lisa. And we will also offer a number of formal and informal learning opportunities. The formal opportunities include individual webinars for the pilot program, and this includes more in-depth information on data collection and submission and the change package. We will also review strategies for improving identification of infants at risk and strategies to get the information on risk from obstetric providers, and also standardizing care for the infants that are affected. We'll also offer the Learning Collaborative, which consists of monthly calls. These are conducted via GoToMeeting over the internet with a less structured agenda, and this allows participants the opportunity to talk to each other and learn from each other's experiences. Although we expect sites to participate in all of these in real time, we realize that patient care responsibilities may prevent that from happening. All of the webinars will be recorded and archived on the initiatives page on the WSPIC website. And if I could have the next slide. So what WISPIC wants from you, we request your active participation and we request your feedback. At this point, I think I turn it over to Eileen.
Yes. Hello. So next steps, if you decide that you're interested in participating in this pilot project, here are a couple of things that you might want to be thinking about when you're making your decision. You will also see these questions again on the application. This is the sort of the questions that you'll be asked. So if you decide to commit to the project, some of the things you might ask yourself is, will you implement the initiative to the best of your ability? Will you collect and submit the required data? Will you participate in the learning collaborative? And will you provide feedback on your participation? These are not judgment questions. These are just questions to think about if you're really able to, or if you're able to do it within the this pilot period. And it's not something that you have to worry about missing this opportunity, because we will there'll be a chance to participate later if you aren't in the pilot this time. If you answered yes to the 4 questions on the previous slide, you can submit your application by June 29th. And again, some of the things that we'll be looking for in the application, we're looking to have a diversity of people involved. So we're looking at geographic diversity, size, experience with NAS and NOWS, experience with Paradata, .NET, and we're looking for a group of people that can really help us think through what it would be like to participate from a variety of perspectives. So hopefully that will encourage many people to apply if it's possible for you. You can apply by going to the WISPIC homepage and clicking on the initiative pilot application, beautifully circled right there. It's not circled on the website, but I'm sure you'll be able to find it. And so you'll click there, or you go directly to our application, and the application link is above. And again, the deadline is June 29th. Staff will, WPP staff will notify the sites that have been chosen for the pilot project by Friday, July 6th. And again, don't worry if you're not part of the project or part of the pilot, because we'll be launching the full initiative in January of 2019. So that will be a chance to participate at that time.
Great. Thank you, Eileen and Paul and Lisa, for going over all of those specifics. Right now, we're going to open things up for questions from all of you. Looking at my question boxes and the hands, I don't see any hands up at this time or any questions. So I guess we covered everything everyone wanted to know. Let me just check one more time. Yeah, looks like we've covered anything. Is there anyone Yeah, go ahead, please, Paul. Go ahead and add.
I just had one item to add. If sites do not participate in Paradata, they may still participate in the pilot and in the statewide initiative. There will be a mechanism for entering the data on the WISPIC website.
Great, thank you. Wonderful. I do have one question that came in that some people were not able, it looks like someone joined this webinar late, and any chance you could email the PowerPoint out to people? I think that we could get the PowerPoint out to people. Sure. That shouldn't be a problem. We can do that. And also, we are going to be posting, you may not have heard though, Gretchen, that we are going to, I'm sorry, that question came from Gretchen Finley. I'm sure others may have had that same question though. We are going to be posting a recording of this webinar on the WISPIC website. So that will be available just within the, we're going to get started on that right away. So that'll be available here within the next day or so, so you can watch for that. But no worries if you weren't able to hear this entire presentation. We definitely will have a chance for you to see it all and get the information. So just watch for that notification. Are there any other questions anyone has about the application process? Or anything any of the speakers have to add? Okay, if not, then we will go ahead and wrap things up. Again, if you have any additional questions, please make sure to contact the staff at this email address you see here, wispic@perinatalweb.org, or you can call the office and speak with any of the WAPC staff as well. Okay, well, thank you, everyone, and thanks to our presenters today, and have a great rest of your afternoon. Thank you. Bye-bye.